survive. Kenny Tahuru, who is 26 years old, had a thriving stall selling second-hand clothes in Harare's largest township at a market called Mpunzizamo, or the place where poverty ends in the local Shona language. It's been closed for a year, and he now tries his luck in the informal market. Now, motorists using the thicker superhighway were 2 weeks ago once again caught up in the mayhem of the 8 p.m. curfew. While the pileup, of course, paled in comparison to the day before the night's containment measures, many motorists complained that the government's enforcement rule. Ngina Kirori was there a week ago, and we can now take a look at that story that leads us into the conversation of the day.
Ambulances must use the inner lane. So that is the arrangement that we have. We say that we're going to be here na tuko hapa leo. Wale wote ambao wanachelewa tutakaa nao hapa mpaka asubuhi.
Police officers from the Kasarani police station set up camp at the underbelly of the Roosters Junction along Thika Road at a few minutes past 7 p.m., allowing a significant number of cars to pass, even an hour past curfew. But at 9 p.m. sharp, the inevitable happened. And anyone that was not an essential worker on duty was blocked from accessing the roads leading to Thika for a second night in a row.
If you are not engaged on duty, you are abusing that privilege. We are not going to allow that. Service providers who are on duty, wale wako kazini ndio wanapita.
A number of those caught at the roadblock under the influence were not spared.
Unatoka ulevi alafu unaweza kutuambia wewe ni mtu wa daktari? Fungua hapa hivi. Weka hiyo gari hapo. Fungua hapa. Unatoka ule. Pime hapo. Peleka hapo. Afungua mlango, hajafungua. Fungua mlango.
This man and his daughter were caught up in the mayhem as he struggled to get his wife, who was in labor, to the hospital. Those on the other side of the highway leading to Nairobi were also frozen, despite trying to convince officers of their reasons for being caught on the road past curfew.
Why should I lie to you?
And at around 10 p.m., the officers gave the strongest indication that motorists would be on the roads for the long haul, as they lit a bonfire by the roadside to keep drivers warm. They were eventually released at around 2 a.m. Some of the motorists, however, complained that they had valid reasons for being on the road and that the extended stay would delay their reporting to work today, especially for those supplying goods.
Tunatoka Isiolo, tumefika hapa saa 3 na dakika 20. Tukasuiriwa eti hatuna barua, na barua yenyewe tulikuwa nayo lakini ni venye haikuwa na rubber stamp original. Wakasema ni fake, wakatuzuia hapa. So sasa tutashinda hapa siku mzima, atuchelewa, hatuna mwelekeo wowote. Tuone kama hii curfew inasaidia, sababu tuko essential services, na rais mwenyewe alisema kwamba watu wa chakula wanafaa watembee usiku essential services. Lakini sasa tunakisuiliwa, hiyo ni kumaanisha nini? Na tuko na barua. Hata kama hatungekuwa na barua, gari yenyewe imeandikwa ni gari ya chakula.
The operation was among several being conducted, including Langata Road, Jogo Road and Wayaki Way, with officers stating that it will continue until citizens adhere to the rules. Health experts have, however, termed it as counterproductive and called for the review on transport regulations during the pandemic. It has indeed been a question of lives versus livelihoods, with the government determined to stamp the authority, especially on the 8 p.m. curfew. But while the numbers may have dwindled on day 2 on Thika Superhighway tonight, the anger amongst many Kenyans has not, as they call it a poor call of judgment on the part of the government. Gena Kirori, NTV.
Let's get you started on that conversation about the social economic impact of COVID-19. Of course, 4 weeks after the government escalated the restrictions that were announced by President Uhuru Kenyatta on the 26th day of the month of March. And this morning, I've got a very interesting panel that I'm about to unveil. But just before we do that, we want you to be part of this conversation by, of course, tweeting us at NTV Kenya and at Victor Kiprop _ using the hashtag #NewNormal, of course, on the question question of the day. We ask you if you had the power, of course, of enforcing the COVID-19 measures, how would you so, as well as protect the welfare of Kenyans? Tweet us at NTV Kenya and at Victor Kiprop _. If you want to call in, the lines will be on the bottom of your screen in just a bit. Let me now just give you the people who are helping us drive today's conversation. In studio this morning with me, Diana Gishengo. She's the campaigns manager at Amnesty International. Welcome to the show. All right, joining us virtually, of course, from Kisumu is Dr. Kevin Osuri. He's the chairman of the Kenya Medical Practitioners and Dentists Union in Nyanza. Welcome to the show, Dr. Osuri.
Thank you. Good morning.
All right, and of course, also joining us virtually this morning is Hilary Omala. Is the executive director for an organization called Carolina for Kibra. Welcome to the show, Hilary.
Thank you and good morning.
All right. Let me start with you, Dr. Osuri. It's been 4 weeks, of course, of this restriction. Some people have complained that they're too tough, but we keep monitoring the briefings by the Ministry of Health every day. We see that the numbers have come down a bit. But of course, it's the third wave. The number of deaths are still high. I think 22 people died in the last 24 hours. But for many Kenyans who do not know how to interpret the numbers, the question would be, where are we at the moment?
Thank you so much. I would want to the socioeconomic impact of COVID. And I would say that, yes, we have observed very stringent restrictions on both the public and even us as healthcare workers. And I do believe that to a large extent, they have helped to avert what would be a crisis or what would have been a very, very bad situation. I think you're aware now, if you look at, the world is looking at India and perhaps what is happening there because they have largely ignored the restrictions put in place by the government and they lacked. So I do believe that to a large extent, especially from a public health perspective, it has been beneficial to our country.
Okay, and I know, of course, you don't sit, don't hold brief for government, but for how long can we, can people start hoping that maybe we will see an easing of these restrictions in the coming days?
Of course, you're right. I don't hold brief for government, but I do believe that the president will be well advised, and so by the Ministry of Health, especially when the numbers are promising, when the numbers have gone lower. I think the take-home message here is that all of us as Kenyans must not drop our guards. We must remain vigilant, and we must strictly adhere to the measures put in place because they are at our best interest.
All right. Thank you. Let me just come to you, Diana, and definitely this is much more than a health crisis. This is much more than just the numbers that we see of people who've been infected and the people who have died. This is much more of a health and social and economic and human crisis.
You're very right, Victor. This is actually a human crisis. What started off as a health crisis, the effects of COVID-19, families that have been affected, infected, and so on, and then the whole community where, as a result of the public health measures, restriction, anxiety, and fear, it has resulted in a human crisis where most Kenyans are now struggling with basic standards of living. We have seen very, very big layoffs of people who were previously employed formally. Now they are jobless and there is no hope in sight, not in government, not in the private sector. Even government, if you look at, say, the IMF conditions, they have been told we need a lean workforce. So we are looking at layoffs even in government.
Yeah.
The education system, our children are studying under a lot of stress because they have to cover 3 years in 2 years. So they will not have breaks. There are all these issues of people who previously could afford private schools have had to move to public schools. Yeah. The public schools had already been neglected, so they are working with excess, not optimal. They are overcrowded and understaffed in that particular regard. As we do all this, the clip you just ran here of essential workers, people who are food producers and so on, all the major income earners of this country, tourism, exports of say flowers, let me not even say flowers because flowers is for a section, but they also employ a huge workforce. Tea, coffee, all those are in crisis. Okay.
And my biggest takeaway from that is just the picture of just how disproportionate the impact can be.
Yes, they are very disproportionate. And what is sad is those who are farthest behind are now being buried into in this particular crisis. People who are struggling with food daily, maybe they would do informal jobs. They can't because of restriction of movement. Imagine, we saw the government putting measures to rescue the hotel industry. But who is being rescued? It is not that person who sells for you maharagwe every day as you go home. It's not the ordinary cafe where every worker in a certain municipality or town runs to. No, it is the big industry. So the inequalities from COVID are simply depressing.
And that is important because I was looking at this report. I'm just trying to remember who was publishing it, and I didn't get enough time to go through it yesterday. But it was indicating that in quite a number of countries across the world, the funds that were meant to rescue the economy were actually absorbed by bigger companies as opposed to SMEs. But because you're talking about how disproportionate the impact can be, let me bring in Hilary Omala because he deals with people in the informal settlements. Hilary, what is the situation like from the picture that Diana is trying to paint?
Victor. Now, we all agree we are looking largely at health crisis. But as you rightly put, it's much more than a health crisis. It's human, it's economic, it's a social crisis. And to be honest, all segments of the population have been affected in one way or another. But the effects have particularly been detrimental to social groups considered as vulnerable. So you're talking about people living largely in informal settlements, older persons, people with disabilities, looking at young people who are cultivating their futures at this particular time. And looking at it globally, you have over 1 billion people in those circumstances. And it's estimated that in the next probably 20 to 30 years, you're likely to have more than 30% of people finding themselves in those kind of circumstances and living in informal and peri-urban settlements. And these are people who have always lacked access to basics of living. Talk about clean water and sanitation, access to healthcare, access to education, and all that. So a health crisis that leads to an economic crisis, leading to food insecurity, access to education, and gender inequalities is what people in informal settlements are currently going through.
Okay.
And the situation is as bad as you've seen it.
And definitely, of course, every time we see, we announce these protocols, and Dr. Osuri would tell you that it is important to follow them. And it may be the reason why we are seeing the numbers coming down. But for some people, it's just almost next to impossible.
Yes, Victor. And sometimes I want to join the people who blame the police, especially on the enforcement arm of doing things. But if you argue objectively, the police are meant to enforce laws that are set by others. And I think the legislation processes in many of these countries, including Kenya, does not factor in human behavior and livelihoods development. You have experts who will focus on how the virus is behaving and not how the potential hosts and the hosts of those viruses are actually behaving. And so when they ask questions such as, is it that the virus is more virulent after 8 p.m., those are not silly questions. They are human behavior questions. And the virus needs a host. The humans don't need the virus, so to speak. And you have had these discussions all over the place. It's all about human behavior, and if we factor this into consideration, probably it will be easier to enforce laws.
Okay. Dr. Osuri, definitely the picture and the point that Diana and Hillary are passing is that sometimes it's a bit hard to enforce some of these things because of how disproportionate the impacts can be. But sometimes we have to make a decision because, you know, it's more like a decision of either you live or you die. Dr. Osuri?
Yeah, thank you, Victor. I think what Hillary and Diana are saying, especially as far as the socioeconomic impact in health component. But I would want to, as an expert, to treat the source usually. Mm-hmm. And for me, in this instance, we are looking at a health pandemic. The impact of, businesses and social welfare and many other things are a product of this pandemic that we are in. We have been shown elsewhere in places that have disregarded some of these measures, how serious it can snowball and the impact it can have on society. I think there are other places in this world where restrictions have been more stringent than in Kenya's situation. The input here would be that perhaps the government should put measures in place. As much as we are handling the pandemic, the government should put measures in place to ensure that we have economic measures or economic, mitigating plans that mm-hmm. would also help, especially small businesses, SMEs, and essentially those who are vulnerable among our communities. But I would want also not to forget the healthcare workers in this instance, who are equally bearing the brunt, the very, very heavy brunt of this scourge. And we have doctors, nurses, clinical officers who have lost their lives in lines of duty. Mm-hmm. We have so many doctors now who have contracted COVID and are living with the side effects of, long-standing side effects of that. So please, as much as we deal with, the mama mbogas and the small businesses, I think we should also think really critically about the doctors who are go and out of, situations where they are losing patients. They are having to deal with cases where they cannot find basic things, essential life-saving facilities like ICUs and HDUs and the rest. So the impact is widespread. Okay. But the onus here is on government to have in place mitigating measures addressing both the economy and the health bit of it.
And you have raised quite a very valid point about the often overlooked impact, because doctors are always busy trying to save lives, and most of the time, this medical and health workers, no one is actually saving them.
Yeah, it's perhaps why I'm here to lift the lid on that. And that the people who are really suffering are the doctors and the healthcare workers who literally spend 24 hours a day mm-hmm. trying to save lives. Very poor systems of health, unfortunately, in this country. The public healthcare system is going further down the drain. It is collapsing, and you can see several counties which initially should have had 300-bed isolation capacities. We have been informed by several agencies that those are a hoax. Mm-hmm. ICUs are not anywhere available. And even the MPs have described this situation and requested to be, provided with special facilities. Yet the healthcare workers struggle in these instances.
Okay.
We have,
Yes, please proceed.
Yes, not only have we lost our lives, but we are also having, injuries and contracting diseases in our line of duty. So I think indeed, really, as much as we think about the economic bit of it, we should really think about the healthcare workers. And you might have noticed at the beginning of this pandemic, even you people in the media stopped to clap for us. You don't remember us anymore. I wish you'd do that and just, give us a shoulder to lean on.
Point noted, Dr. Osuri, points noted. And certainly, let me just hold you on that very same point, because you've mentioned that we've lost quite a number of doctors and health workers. And during the beginning of this pandemic, there was the issue of, doctors and medical workers having to operate without sufficient PPEs, and people having to go into maybe use the same equipment they used yesterday. And coincidentally, today is actually the World Day of Safety and Health at Work. Do you feel safe enough, especially during this pandemic?
From the beginning of the pandemic, when it was first declared in Kenya on 12th March last year, we've never felt safe. We are working under very difficult conditions, I can guarantee you that. It's even worse now than when it started, because by the day, you still get substandard PPEs. We are more exposed because even the public now, most of us have actually abandoned the measures that are put in place to try to prevent COVID. So equally as well, we are overburdened. Remember, we still have the same diseases like HIV, AIDS, diabetes, malaria, and other things. So by and large, we are stretched even at our places of work. I have seen doctors who have gone for 72 hours without sleep because they work in ICU. You find one doctor handling so many patients. And at the same time, the ICUs are full. They are losing patients. No one gives them emotional support. We don't have psychosocial support. Some of us are going crazy. So the pain that we are undergoing is enormous. And I really do believe that I wish that the government would take a step back and think about the caregivers who are really taking care of the patients during this pandemic.
Very important point, of course, Dr. Usuri. And another point, of course, that is raised, Diana, is the issue that the difference between last year in March, when we had almost a similar level of restrictions as we have now this year in March, is that they were actually accompanying stimulus packages, relief measures. We saw the VAT being lowered and all that. But this time around, we are not seeing anything like that.
Yes, and I think it speaks to how we plan as a country. And before I delve into that, allow me to let Dr. Usur know that we really value our health workers, and we understand and we see the strain that they are going through, the mental health issues, psychosocial support is lacking. And most importantly, that even as we decry that the public is not adhering, say, to certain restriction and so on, restrictions ought to be accompanied by mitigation measures. So if this is a health crisis, we should see the government proactively investing in the healthcare system. By now, 1 year down the line, they should anticipate that the infections would be, they've been told by the expert, the third wave is more lethal and fatal. So the burden of caregiving is higher. We've not seen an increase in healthcare workers, be it nurses, clinical workers, or medical doctors. We've not seen an increase in that. We've not seen an increase in bed space, isolation or otherwise. If anything, look at Kakamega County, which is praised for being one of the counties that has really invested in health. The oxygen scandal at this particular point, where people are also failing to adhere because there's no help. Kenyans are on their own. If you can't afford to book a bed in a private hospital, you know you're on your own. So if you have devised your own, I don't know, herbs or whatever, or faith in God, you have no business listening to the government. So the approach has generally been wrong. And when doctors speak, they explain to us, this is a health crisis, mask up. Okay? When the police come, they remain the national police force rather than service. There was he an OCPD in Eldoret who decided, I'm going to affirm people and educate them. There was no crisis in Eldoret, and people masked up. When you beat people up, it becomes mere compliance. They don't understand it. So it becomes a very, very big problem. But having said that, I do agree. One, I think there has been, I don't know whether the government is serious or whether they understand the magnitude of the problem, because we close 1 year By now, people have strained some more. They've opened schools. Some people have gone to their rural homes. Others have remained here. The tax goes up. VAT, which was reduced, now goes up. And we are anticipating a further increase in July. What does this mean for livelihood? The price of bread is now 55 shillings. Okay? Bread, just like ugali,
Fuel.
is a very basic thing. Fuel. The minute fuel goes up, everything from masks to socks will go up. And nobody is reflecting on this particular reality. And I know in most countries, whenever there's a crisis, we review tax measures. Okay? There are people who get reliefs, and sometimes taxes must be collected for collective good. Unfortunately, in this country, Victor, I don't think we have any confidence that our taxes are being utilized for collective good. No.
Certainly.
All we get is announcement that 2 billion is being lost every day. Surely. Why would you let people make people put part of their income or the little income they have into the national kitty, then you steal it. A few people steal it, and it is business as usual. All the money, grants, donations, loans that are attributed to COVID, they've not gone into the healthcare system, which would have made it better for all of us. If all of us had gotten to the point of vaccination, we are sure we would get medical facilities, then we would be able to retain measures of masking. Those who can social distance, they do that. With time, we would be sure we are reopening the economy. Because places like markets, what do you expect them to do to earn their livelihood?
And I'll just come to you back to what you're raising, but let me just go to Hillary at this point. Hillary, definitely the point that she's raising is that there are no accompanying stimulus measures or tax reliefs this time around like we had last year. And I'm sure the impact for those who are more vulnerable in the society is almost immeasurable.
Yes, Victor, and first, before I go into that, just back to Dr. Osur and reiterating what Diana has said. We truly appreciate what the doctors and all healthcare workers are doing in this country. I'm one of those, and I truly know what they are going through. But until we recognize that there is an interface between a health crisis, an economic crisis, a human crisis, and a social crisis, we are not likely to be able to solve these issues. You're right. Last year, we had those incentives, I would call them. But I would consider all these temporary solutions, mainly for symptomatic relief of what the country and people in vulnerable conditions are currently going through. What a country needs is a social protection system that takes care of the longevity in terms of livelihood developments. Look at it this way. 70% of people who live in informal settlements are truly skilled. I work with them and interact with them on a daily basis. The plumber, the electrician, and every technician who comes to your house is likely to have come from those places. But what they do not have is income security. They are not full-time employees. They depend on factories, they depend on companies, they depend on construction work and related things. And so when such a time comes, such people do not have a way of ensuring that they keep their livelihoods going. And that's what results into an economic crisis, food insecurity, effects on education because they can no longer afford to pay their school fees, and then overall gender inequalities. You had this talk going around that people saying, I would rather die of COVID-19 than hunger. It's a reality. One is a disease, and diseases are known to have to cause death over the years. But the other one is a provider irresponsibility. A good parent won't sit in their house and watch people die of hunger in the name of protecting themselves from catching an infection.
Dr. Osuri, let me come back to you on this because earlier in the show you mentioned that indeed these measures are, first of all, very important, and number two, they are actually working to bring down the numbers. But the concern that most Kenyans have actually is not necessarily the measures themselves, but how they're being implemented. So someone would tell you that the restaurants, the hotel chains are complaining that, by the way, for them, they have been maintaining the 1.5 meters social distance. They make sure you sanitize before you go in. You probably have your mask before you go in, and you only remove it when you want to eat. And they have been shut down. But you go to the places like markets. I was in, I believe, Gikomba a few weeks ago. I couldn't go into the market because the sheer number of people who are in that space and trying to cramp up. And of course, it's much connected to what Diana was saying. They're just trying to you know, make a living or make a living for themselves. But at the end there is a feeling of some bit of discrimination in the implementation of this measures.
Of course, there's discrimination. All of us can see that. You get that when we initially had the first wave and it subsided, social media was awash with what people were calling fast spreaders. The very large political rallies, even the head of state hosted be a very huge gathering somewhere in Sagana. Yeah. And I can tell you this is discriminatory because there are those who are, you know, restricted from gathering and there are those who are allowed. And sadly, all of us have to now bear the consequences of such, you know, reckless leaders and reckless behavior on the part of Kenyans. But I will tell you from a scientist's point of view, if you have a tumor and it manifests symptoms, the best solution, as you treat the symptoms, is to chop off that tumor. And in this case, this tumor would be the COVID pandemic in itself. As much as we are handling the symptoms, which would be the resultant, you know, issues like making sure that people don't congregate, masking up and hand washing and all that, we have to fight the pandemic, especially from a health perspective. We have to show up numbers on vaccination. We have to ensure that those who are sick are appropriately taken care of in hospitals, and they don't even contract that same COVID in the hospital. There are patients who have gone to hospitals just to seek, you know, malaria care, and they come out with COVID. So I think we have to make sure that even our hospitals, where unfortunately I can tell you there are hospitals where some patients are still sleeping, two or three patients in the same bed. You can't tell me in a health facility that would be social distancing. And I think we really have to do better in terms of our public health care system. Like Diana has said, we have to employ more doctors, get more people to deal with this pandemic, employ more doctors, employ more nurses, give them better facilities, show up the numbers on vaccinations, avoid the politics about, you know, Sputnik and Johnson and all these things, but vaccinate the population, protect the population so that everybody can get back to work. I think that is a take-home message. Let us deal with the symptoms, and at the same time, let us employ aggressive measures to deal with the basic tumor.
Okay, I think we have a caller who wants to join the conversation. Benedict, good morning. If you can hear me, do you have a question, Benedict?
Good morning to you guys. Good morning. Hello?
Good morning, Benedict, if you can hear me.
Now, yes, I can hear you. Now,
yes.
Laughable when I hear somebody says the measures that the government put help to reduce the COVID-19. If we are being told for us to avoid COVID-19, we wash our hands, we keep social distance. Enda town usiku, wakati wa rush hours. Tell me how many people wako pamoja. Since when watu waliacha kunawa? The government yenyewe, instead of giving us something yenye inaweza saidia, wanatumiza. Sasa wameleta jab. Hiyo jab, kuna says hapa, kuna wengine wanasema ina clot damu. Let me tell you, for me, I will not take that jab. Because issues nasikia zenye zina surround hii jab ni mingi na hakuna mtu anatuambia ukweli. Either they are rumors or ziko ukweli. I had a story of 3 people wenye wamekufa. Sasa kuna matanga. I worked in Gikomba where nilisikia ukisema watu wako wengi. We work as usual. There is somebody mwenye nilisikia alipata hiyo jab na akakufa immediately and then ikaenda silent. Mimi mwenyewe nafia kupata hiyo jab. Alafu hii mabati hizi measures zina reduce COVID. Trust me not, inaongeza. Kwa matatu, rashawa ikifika saa 2 kamili, polisi wataturushia teargas. Tunaingia kwa gari yenye inafaa ibebe 14 seater, itabeba 28 seater. So that tufike nyumbani tusichapwe na mapolisi. I think it's high time the government knows sisi sio watoto wake wenye watatucontrol vile wanataka. We are taxpayers of this country and we need to have a say on our taxes. Kwa sababu sasa hivi wanasema COVID-19 iliibiwa. Kuna couple wenye walisemekana walikula hiyo pesa. They are working free. Jamani tupea mask. They end up selling the masks zenye tulipewa and then mnatuambia kuna COVID-19. Bro, I really doubt it.
Thank you. That is Benedict from Donholm. Diana, definitely the frustration is very raw and very real.
Yes, and rightly so, because Benedict raises a very valid point. That what sort of planning did the government make in creating sanctions or putting in place measures, say in Nairobi, where everybody is required to be home by 8. Employers have not, unlike last year, have not revised their working hours. So most people still leave their office at 5, 6, 6:30. Okay? Then you have that particular duration. Nairobi is what it is. Wayakiwe and Mombasa Road is under construction. There's nobody who is going to put their vehicle, a new vehicle right now, in the matatu industry where there is social distancing and airplanes don't have social distancing. You get? So because of that, we end up seeing a lot of crowding, huge crowds coming together, and in the push and shove of trying to board a matatu, then there's a lot of spread of COVID. It doesn't even stop there. Think about the government and how many evictions have happened during the COVID period. There is. This is a respiratory disease. So why would you, then you evict 300 people? They sleep there for 3 nights. What are you doing? How are people supposed to believe that you're being genuine about what the measures that you're putting forward? I don't know whether to say fortunately or unfortunately, COVID affects all classes, all people. But when the political class is affected, their barriers are super crowded. They are allowed limitless people. They are allowed to retain their status. Okay? So people must come in. And even if it's streamed, they are still very high numbers. So Kenyans have lost confidence completely. And you can never, all these measures amount to restrictions of rights. Okay? Because when we can't move around, that's freedom of movement. So human rights have been restricted during the entire COVID period. That limitation must be proportionate and justifiable. And there must be something being done so that it is not permanent. Right now, all we are waiting for is when there will be an announcement, figures are down, we go back to politicking and as usual. But the doctors have clearly said what is required. Resource the healthcare system, vaccinate people, educate people on the vaccine. Polio, we have gotten very good polio vaccination. If we were to get the same level of education and research into the COVID vaccine, Johnson, Sputnik, or whatever, or even a Kenyan vaccine, it's possible. With that type of education, people would have confidence. But now you want people to say, I'm waiting to die from COVID or its effect on my livelihood. No, people must look for something to hold on to. And right now it's very clear the person to bash is government. The government has been outright irresponsible and failed its citizens.
Of course, I'd like to go to Dr. Osuri to respond and dispel Benedict's fears on the vaccine. But just before I do that, let me go to Hillary at this point. Hillary, if you look at what we saw on Thika Road, and the point that Diana is raising is that sometimes even in the enforcement of these measures, we sort of don't see the human face that we expect from the authorities. And the end is the enforcement ends up being a bit crude and almost rolling back on all the gains that we made the whole day in terms of social distancing and washing our hands.
I totally agree, but I would again say police are largely enforcing the law. If you tell the police, make sure everybody is asleep by 8 p.m., they'll do exactly
They will
that.
get you sleeping pills.
They will get you sleeping pills or keep you on the road for the entire night. I would argue that the people who set these directives need to think through their approaches. It's more of a planning issue than just enforcement of law. What is so difficult in taking a sector-based approach where the directions are broken down to specific sectors? Pick a supermarket, for example. Human behavior is that we shop on our way home. And that's usually anytime from 4 p.m. to 6 p.m. And you have seen right now the supermarkets are closing between 6 and 6:30. There is a worker there who doesn't necessarily drive and lives across town. And supermarkets are not the places you just close and go. You have to take care of a number of issues before you leave.
Yeah.
What is the crime in that person getting home late? I truly don't understand. But what if we said these sectors must close at this time? The following set of sectors should close at this particular time, just to allow for humble time for everybody to get home and avoid the congestion that we see on the roads every single day. When it comes to enforcement, those definitely don't matter. You have seen people argue that I don't need to read the law. The police will interpret for me. So what the police will do is what the law is. It's more of a planning issue of that.
And when you mention planning, definitely we are talking about a 6 million or probably even 8 million person city like Nairobi. The fact that sometimes it has to get to midnight before all of us actually leave the CBDs. Okay, part of it is, of course, because some of us are still working late and all that, and some businesses are not closed. But part of it is because if you asked all of us to leave between 12 and 1 p.m., definitely we can't evacuate the entire population of the city out of the city within that period.
Yeah, Victor, would you rather have millions of people scrambling for transport in the evening than spread the time for people to leave for their homes and just make sure that that happens?
Okay.
Where I work, for example, we can comfortably close our offices at 3 p.m. And we just make sure that everybody is at home by 4 or 5. And those people who have to close after 6 take their time. And what is the crime of having such a person getting to their home at midnight? If they are social distancing in a matatu and enjoying their ride back home, what is the crime? I mean, some of these things you just need to put into consideration. Yes, you say a human face, by human behavior and how we operate, how we develop our livelihoods, and how things work in a civilized society.
Okay. Dr. Osuri, just before we go for this break, I want you to, of course, go back to dispelling the fears that Benedict had with the safety of the vaccine, and also address the entire issue, because clearly there is so much that needs to be done with regards to educating the people with regards to the COVID-19 vaccine.
Thank you, Victor. I would be very brief. That's telling that the vaccine that we are being given in this country is safe.
Yeah.
It has been proven to be safe for all of us. I have taken it. Many doctors have taken it, and we would not take it if we didn't believe it was safe. So it is indeed safe, and it can help to also help us to fight this pandemic of COVID. But that said, I would want to echo the sentiments of Hillary and say that perhaps we are being failed also by our law enforcement. this COVID restriction, especially with regards to how the police handle it, it's not a matter of a hammer and nail situation. And recently I saw, and I believe there's no wisdom at all. There's no iota of wisdom at all in cramming and, you know, smashing windscreens of motorists who are late from work and trying to rush home. I mean, it is utterly despicable to watch such kinds of things. And we cannot have any excuse for that, to have police vandalize people's property in the name of lateness, you know, to get home, for systems which obviously are the government's failures. I mean, nobody wants to stay in a jam on his way home.
Yeah.
And indeed, even our law enforcers should be given some basic education on COVID handling and COVID restrictions. They are also exposing their own lives by, you know, cramming people in cells, in their vehicles, and, you know, lobbing tear gases like you saw the other time in Likoni and other, you know, places.
Yeah.
So indeed, it is all collective responsibility. As much as Kenyans are required to behave well, indeed, everybody should behave well to curb this pandemic.
All right. Of course, what a great conversation we're having this morning. Dr. Kevin Osuri is staying with us before this break. And of course, Hilary Omala, Diana Gishengo are all staying with me for this conversation. We have to take a quick break, but you also need to stay with us, because when we come back, we will be talking about how we can sustainably move forward. That means we can control the numbers of COVID-19 from going up and as well take care of the welfare of Kenyans. Don't go anywhere.
Vaseline Skincare. Vaseline has a triple purified formula that creates a layer that locks in moisture, which allows your skin to heal from within. Vaseline applied before you sleep can help restore your face's natural level of moisture and softness.
To keep skin restored, that's the healing power of Vaseline.
Introducing Nestle Ceregrow Growing Up Cereal. Each bowl of Nestle Ceregrow contains the goodness of cereals and nutrition your child needs to blossom. That's one less thing to worry about. Nestle Ceregrow. It's all good, Mom.
Shushu, wamesema hakuna harusi.
Kwa nini? Hapana, haiwezekani. Mamisa harusi lazima itaendelea.
Pike Brian record tustreamiwe tu.
Nasema Safaricom iko na 500 MB free kila siku. Sasa tunaweza kustream hiwe tu.
Hi Shushu.
Get 500 MB free kila siku and never miss a moment. This week on Lit 360.
This was like the start. Then the bass. And then there was some drums and the drums. Pray that we don't make it, sending love to the inflated body ready to jump now. Simmer down, jump now, simmer down.
Yo, hapo hivi ni Watchman Kingoto, Mr. Mkuruweng, and you're watching Lit 360. This is your boy Edu Maddox. Olan.
Wow, thank you for your time. How juicy.
Juicy.
The Directorate of Occupational Safety and Health Services invites you to a virtual high-level panel discussion on occupational safety and health live on NTV on Wednesday the 28th of April 2021 from 7:30 p.m. to 9 p.m. as we commemorate the World Day for Safety and Health at Work 2021. The theme for this year is Anticipate, Prepare and Respond to Crisis, Investing Now in Resilient Occupational Safety and Health System. The Directorate of Occupational Safety and Health Services. A healthy worker in a safe work environment.
Try Panadol Advance for relief from headaches, body aches, and fever. With Panadol's Optizorb formula, the tablet gently breaks down in the stomach, quickly absorbs, and starts providing pain relief in 15 minutes. For fast and effective pain relief that you can trust, try Panadol Advance.
I told you, Dr. Kevin Osuri is still with us, the chairman of the KMPDU Nyanza region. Diana Gishengo from Amnesty International as a campaigns manager is still with us. And of course, Hilary Omala from Carolina for Kibra, one of the organizations helping the people of Kibra are still with me as we continue that conversation about the socio-economic impact of COVID-19. And let me start with you, Dr. Osuri. Part of the other concern that a number of people have had, of course, is with the issue of the vaccine. You've tried to address it, but there were concerns about the pace at which we are vaccinating the people. While some nations, I think in the news that Botswana has already, acquired vaccines enough to vaccinate all its adult population. Kenya, on the other hand, of course, we were talking about, I think, 2023 or 2024 for vaccination of the entire population.
Yeah, thank you. I think, and I agree with you that the pace at which we are vaccinating our citizens is very slow. The order is also quite interesting in the sense that Kenyans are trying to cut corners. And just like they behave in traffic jams, you find a number of them who are not eligible for first phase vaccines showing up and using godfathers and so on and so forth to get the vaccines. And we've also had scenarios and instances where we have heard about, fake vaccines being sold and all that. Mm-hmm. So yes, the actual vaccine which is being given in Kenya is safe. But I would really urge the government to ramp up the numbers and really ensure mass vaccination. This can only be done by procuring more vaccines and hiring more healthcare workers to vaccinate the people. That is the only way that we will ensure that we are all completely covered. And also, allaying anxiety to make sure that the second dose, which is due for many of us, myself, I think around 15th of May, I should be getting my second dose. Mm-hmm. We should have those fears allayed that those vaccines will be here in time, the distribution will be proper and safe, and everybody will get his vaccine on time. But the secret here is to get more numbers, get more healthcare workers on board to ensure that everybody is vaccinated. But even as we talk about getting those more vaccines, there's been a concern that most African countries are actually relying on the UN-led initiative, that is the COVAX initiative. And for a layman, it almost feels like waiting for these other developed countries to, sort of vaccinate quite a significant part of their population before they spare ile kidogo ibaki sisi tupatiwe. Yeah, there are those stories which we have all had, but I do believe that if Kenya government was really determined to get vaccines, including even to procure these vaccines and buy them, we would have those vaccines here on time. I would rather we get loans to buy vaccines, but not to do all these other things we're doing, because Kenya is literally at a standstill. As the other panelists have told you, people have put their lives on hold for over a year, including very critical sectors like the education sector. So we should pause everything else we are doing and do all we can, including every player in this sector up to the legislature. We should all focus on this and ensure we get vaccines. And I'm very confident that if everybody puts his head together on procuring the vaccines, we'll get the vaccines here on time.
Okay, and just before I let you go, you're almost sounding like the vaccine from where we are, given the fact that these numbers had gone down, they have gone up once again. Countries like India and Brazil had already seen their numbers go down. They go back again. So the numbers go down, we reopen, they go up, we close again. You're almost sounding like the vaccine is our only way out.
No, like I said before, we are doing everything we can, especially to get these numbers down. The near best shot that we have right now is the vaccines, yeah, and that is why I am hoping and praying that we can ramp up these numbers. We have already put in place all other measures, including social distancing and everything else. But seems to be the best solution right now is to get the vaccine. And I can tell you that it is promising, and in other places across the world has shown promising results.
Okay. Just before we check this call, Diana, at this point of almost life and death, this vaccine now is almost more of a human right. It should be up there in terms of priority, isn't it?
Yes, vaccine, and when you break down the right to health, the highest attainable standards, I am not an expert, but Dr. Osur says this is our chance, and most medical and public health practitioners also indicate that. So if this, and most of the times why the healthcare system is this neglected is the assumption that this is an economic and social right. So it's progressive, we can wait, we are only putting in place a few plans for us to be able to finally resource. But this has now come to the point where the right to health around COVID protection has affected all other rights. Okay, political gathering, campaigns, those are political rights, economic rights, livelihoods, and so on. So it should be a major priority. But sadly, if you look at Parliament, when they were working on approving the 2021 budget, they slashed the health budget. It took a lot of repitching by experts for them to even consider enough resourcing for the first batch of 1 million vaccines.
Okay.
Now, we are arguing that we need the entire population vaccinated or inoculated.
Okay.
If it's a human right, then it must be accessible to everybody who requires it. Okay, it is okay for us to work on an equitable basis by prioritizing the frontline workers and the most vulnerable population. But the elderly alone in this country are 1.5. We have 1 million vaccines. Health workers are how many? Teachers. We are still doing very, very badly. And it's unfortunate that parliamentarians who have the power to ensure that money is set aside for this particular health response are also sharing with us the social media and media spaces and
complaining just like
and complaining.
All right, and of course I have to check this call. We have a caller from Migori. Good morning, sir. Mogeli, if you can hear me, Mogere from Migori, if you can hear me, good morning. What do you have to say?
Hello.
Yes, Mugere. I think he's, of course, we have a problem with this call, and we have to, of course, proceed from where we are. And we will be, of course, sampling part of the feedback that you've been sending us in a while. But we have to talk about how to sustainably move forward, because we have spoken quite comprehensively of the issues that we face and how we need to move forward. But just before we talk about that, Hillary, from where you sit, because we've been talking about the issue of allowing commercial and people to privately acquire vaccines. But there are, of course, people in the informal settlements, which once we go that route, they may be the ones who are left out. From where you sit, what's the best sustainable way to move forward with this issue of vaccines, considering there are those who are able to buy for themselves and they should be rightfully allowed to do so, and there are those who can't?
Thank you, Victor. I would argue that even if the country had millions of doses right now.
Yeah.
The uptake would still be as low as it is today.
Why?
And the hesitance in terms of taking the vaccine is actually expected. The last time such a pandemic happened, we are told, is about 100 years ago. And we are used to this, a few disease outbreak conditions such as polio and so on, and vaccination is announced and is done door to door and things like that, and people are used to that. But when you have a pandemic of this magnitude and everything is as new as it is right now, it takes a lot of education at the community level for people to actually go to hospitals and take up the vaccines.
Mm-hmm.
I would say the government did very well in terms of coordinating participatory efforts last year. But for those of us who attended planning committees with government will tell you that right now, none of those is happening when we truly need them, because the vaccine distribution requires a lot of capacity,
Mm-hmm.
and we have so many organizations, including non-governmental organizations such as ours, that are better placed to facilitate these processes than a government-run process. And until we get there, the distribution and the uptake will remain low as it is right now.
What risk do we run if we don't make this a bit more inclusive?
If we don't make it as inclusive as it should be, then we won't be able to achieve what we are calling a herd immunity. Remember, the other day, the Minister of Health said they need to reach up to 60-70% to achieve that. If you have 3 million people, for example, in Nairobi, living in informal settlements and can't access these vaccines, then you're talking about 70% of the population in Nairobi lacking that access.
Mm-hmm.
So until we devolve that function and make use of the partnerships we have with non-governmental organizations, it's unlikely to happen in the foreseeable future.
Okay. Dr. Osuri, you mentioned earlier the issue of the politics of which vaccine should we use, which one should we not. But clearly a good number of them are actually certified by the World Health Organization and top research organizations.
Thank you. I think that goes back to also, perhaps on this I may disagree with our panelists a little bit.
Yeah.
I would still affirm that the business of procuring vaccines, especially as an essential commodity as this, it would be opening a Pandora's box, and we will have all kinds of unscrupulous businessmen.
Okay.
Just like we bring things like that. There are already speculation that if we get to a point where we'll have a vaccine, different players, especially funny businessmen, will be at play to make a kill out of this. So my position still remains that for vaccines, I would still suggest that the government needs to take a lead role.
Mm-hmm.
They can partner with other relevant organizations, but not to privatize its procurement and its sale. Otherwise, we'll find ourselves in a very, very dangerous situation,
Mm-hmm.
especially from a healthcare perspective.
Okay.
To the question, I would say that yes, we have front runners for vaccines. Remember, there are some vaccines still being tested and being developed.
Yeah.
So already we have, Sputnik, we have AstraZeneca, Oxford, there's Pfizer, there's Johnson & Johnson, all which have received WHO, certification and accreditation. Of course, different countries will choose different vaccines. I think ours, we went for Oxford AstraZeneca, which I can assure you is safe by, scientific standards. So the politics around it, I would really want to avoid. But just to say that the vaccine that we are taking is indeed a safe vaccine. And to also reiterate what I have said, that I think the business of procuring essential commodities, especially one that is potentially life-saving as this, needs to be led by the government and not private practitioners.
Okay.
Or private business.
All right. Yeah. Very, of course, important point there by Dr. Kevin Osuri. And of course, we've been sampling part of the feedback that you've been sending us. Let's get to see what some of you have been saying on our social media pages, if we can get that right now. Remember, on the question of the day, we asked you, given a chance to govern, how would you apply the COVID-19 prevention measures whilst protecting the welfare of Kenyans? Given a chance to govern, how would you apply the COVID-19 measures while protecting the welfare of Kenyans? We have Feliz Fritz Navidad. I don't know if that's your real name. He says, my main focus would be for the old and vulnerable people. We all know the work from home does not apply to everyone. Thank you. Zablon Kanono, he says, nothing to apply. Let people work as normal to earn their living. Thank you, Zablon, of course, for your feedback. Alvin Mashi says, use the kitty to ensure masks and sanitizers are available to all citizens. Start a program to educate the prevention and safety to all. Sack corrupt officials and equip health facilities. Thank you very much, Alvin Marsh. We have some more. Yes, we do. Anthony says, advocate for mass vaccination, especially in urban areas, by allowing even private entities to import WHO-approved vaccines. Thank you, Anthony. I think Dr. Kevin Osuri has already explained why that may not be, of course, good to allow. Robert Jones says, strictly make sure there's no public gathering, especially in political rallies. Thank you, Robert. And of course, lastly, we have Akinyi. She says, more caution as advised by doctors. Thank you very much for all of you who have been sending your feedback. We can't sample all of it. That's what we could for the moment. And thank you for all of you who keep calling in. We'll try to take those calls whenever we can. But Diana, clearly there's some valid points from some of the comments that we are receiving.
Very valid, because one, I do agree that for us to move forward, the biggest lesson we've learned from COVID is individualism, capitalism will not work. We will not be safe. Nobody is safe until all of us are safe from COVID. And that is unlikely to happen in the private sphere. Because the private sphere is for profit. So investing in the public system of vaccination, healthcare, and so on is critical. As we speak, we are already suffering a confidence deficiency in the meds facility that is responsible for procuring medical supplies in Kenya. There has been, that's where we had the earlier mafia scandal. Then you have KEMSA and the COVID millionaires, okay, that outrightly just misappropriated throughout the public good and decided to profit themselves. And this is something that is even being raised by other partners who support the healthcare system. The healthcare system in Kenya is largely supported by private, like bilateral partnership, donation, grants, and things like that. So it is time, one, to reprioritize health. We must bring accountability in the health sector and build. We need to feel safe. Vaccination in the in my dispensary in Muranga, the other one in Migori, has to work. We now realize Nairobi Hospital is not good enough no, sorry, let me take that back. Private hospitals are not good enough for us. We need to get to a point where all these governors and senators who are writing poetic things are speaking to what has happened in our public hospitals. So we must resource that. Once we work on the healthcare system, we must also rework our industries, our key income areas, because one, the lockdowns of the borders, we couldn't close our neighbors because they feed the country. We are a net importer of food. So food security is a big problem, and now it is time to invest. Even as we speak to devolution, let us reinvest in agriculture, livestock farming, make it meaningful by ensuring that every farmer, whether you're a pastoralist, a fisher folk, or anything like that, every source of livelihood counts, because we realize we are part of a bigger ecosystem. And finally, just accountability. Corruption has really dealt us a blow. If Kenya was not a corrupt nation as we are, we would have made more strides. That is why Botswana is ahead of us. Rwanda is ahead of us. They are not more wealthy than we are. Okay, maybe Botswana, but because they are more accountable,
Yeah.
the rule of law works, public interest counts, they're ahead of us. So we have to rebuild even our values as a country if we are to make any strides
All
forward.
right.
Yeah.
Wonderful. I believe that's very good for your closing remarks. Let me, of course, also get the closing remarks of Hillary. Hillary, clearly there are people who are vulnerable, and they will continue to be vulnerable. And the more we apply these restrictions uniformly, it means they will, of course, continue to be more vulnerable, and some of them will actually slip into more poverty. From where you sit as someone who deals with people like this every day, what's the most sustainable way to move our fight as a country forward? Of course, considering the points that Dr. Osuri has made.
Yes, Victor, I'll first comment on vaccines.
Yes.
I agree with Dr. Food that government should remain in control in terms of purchasing them and the distribution.
Yeah.
But they should also allow for variety. We love variety. And people who can afford to pay for vaccines such as Sputnik should be allowed to do that. All we care about at this moment is herd immunity, which can only be achieved, in fact, as many as possible. I also like somebody's comment, the person who mentioned that let us open up and let life continue as usual. It's not that they don't care about their life. They're just talking about mechanisms that should be put in place to ensure that there is continuity of life. If we want to move forward, I would just do two simple things in my closing remarks.
Yeah.
One, social protection systems that just make sure that we can manage issues of income security that is able to overcome the shocks that come with pandemics of this magnitude. And then number two, all planning must be participatory and should include human behavior aspects of how we do things.
All right. Thank you very much, Hillary. And to Dr. Osuri, just before I get your closing remarks, the caller who dropped them, the question that he had for us, and I want you to respond to, is clearly concerned by the situation that we see in Brazil and we see in India, where people are queuing to receive, and yes, that is the question actually, is asking why don't Kenyans believe COVID-19 exists? So the point was, he's looking at the situation in India, the situation in Brazil, and is concerned that Kenyans are still not taking it seriously, given how it has ravaged even more advanced and developed economies like India and Brazil. How do we make people to be much more aware of this situation?
Thank you. I think being brutally, honest is that any Kenyan who still doesn't believe COVID-19 exists surely cannot be helped. Beyond that, we have lost many lives. I think in one way or another, every Kenyan now has either lost someone they know or has lost a relative, or someone has been affected by the same. So COVID-19 is real. It is not a hoax, and the sooner everybody appreciates that, the better.
Okay.
I think. Yeah.
All right. So, and then in your closing remarks, then from the point where you sit as a doctor, as a representative of the union that is KMPDU in Nyanza region, talk to us about the sustainable way to move Kenya's fight against COVID-19 forward.
I would put the government shareholders and all make sure that the population is protected, especially with regards to their socio-economic welfare. Need to cushion our country. We need not to tighten the noose, like Diana was saying that we are told about, possibilities of raising tax, raising the cost of fuel and many other things. I think the people need to be cushioned. We have very, very vulnerable population out there who are really bearing the brunt, especially with regards to these restrictions. I would also wish to reiterate that we need to improve our public healthcare system. It is not able to sustain any huge pressure, especially with a spike in the waves. We cannot sustain the crisis that would come if, say, we had a situation like currently is in Delhi and other parts of the world. So I would encourage that we make sure that our healthcare system works, in a way that we have more healthcare workers and also the facilities are better equipped.
All right.
Finally, I would say that most importantly, we need to have deliberate plans and deliberate policy frameworks and intent on making sure that our healthcare workers are also protected, especially with regard to, we have the WIBA Act of 2007, those who get long-term illnesses or disabilities out of COVID and other things, those who lose their lives deserve due compensation. And indeed, even those who are working need to have proper psychosocial support and even mental health issues. So please, let us also take care of our healthcare workers who are doing all they can to make sure that this country remains afloat.
All right, many thanks. Dr. Kevin Osuri is the chairman of the Kenya Medical Practitioners and Dentists Union that is in Nyanza region. Of course, also Hilary Omala from Carolina for Kibra, a non-governmental organization, of course, in Kibera. And of course, in studio with me this morning, Diana Gishengo from Amnesty International. She's the campaigns manager. That brings us to the end of this very, very, very interesting discussion. We hope you have enjoyed, and of course those who the relevant authorities who are supposed to act on some of the things that have been raised will actually do so. Don't go anywhere, because at the other end of this break we will be talking about the World Day of Safety and Health at Work, and we will be telling you all about that. Don't go anywhere.
May I?
I'm not your maid. Kama unataka kahawa, fix it yourself.
You're acting crazy.
Unajua ni wanaume wangapi huko nje they died to have 1 second with me. Yet you're here cheating on me.
Perhaps we need a break.
Ati? Ujue hiyo mdomo yako ninaweza ingoa. Yutupa kwa ite kuliwa na dogi.
Kuna mse fulani amededi pale juu, landlord amepatikana.
Hall inaenda jela sasa.
Hakuna kitu watajua unless ujipeleke.
Mimi ndo nilimuua.
Beat sensitivity pain fast with Sensodyne Rapid Action for clinically proven relief in 60 seconds.
There's one thing that all soaps do, it's wash. From buckets to basins, bathrooms to streams, and everything in between.
All soaps wash.
Yes, but Protex is different. Its reinvented formula with flaxseed oil boosts your skin's natural anti-germ defenses by 10 times more, protecting you against 99.9% of germs. So what keeps us healthy?
Protex.
Protex. Good health starts here.
The Trend, 10 p.m.
As
Optiven celebrates 20 years in business, we shall mark this great milestone by unveiling our new brand identity and also launch our journey into the Nairobi Stocks Exchange's Ibuka Accelerator program. Join us live on NTV from the Serena Hotel this Thursday, 29th of April 2021 from 8:30 a.m. to 9:30 a.m. as we start this new journey.
Try Panadol Advance for relief from headaches, body aches, and fever. With Panadol's Optizorb formula, the tablet gently breaks down in the stomach, quickly absorbs, and starts providing pain relief in 15 minutes. For fast and effective pain relief that you can trust, try Panadol Advance.